to Aesthetically Speaking. The aesthetic industry in South Africa is growing rapidly, but alongside innovation and accessibility, serious concerns are emerging. There are reports of unqualified individuals posing as medical professionals, counterfeit dermal fillers entering the market, and unsafe devices being used on patients. And this is increasingly becoming a concern. There are regulatory bodies that are supposed to protect both practitioners and the public, but enforcement gaps and online supply chains may be creating opportunities for dangerous practices. And so today, I'm going to be speaking about this subject with a general practitioner with an interest in aesthetics, Dr. Reza Mia. Thank you so much for joining me today.
Only a pleasure. Thank you for having me.
And Doctor, you've been creating a lot of awareness online on social media platforms about this problem. How serious is it?
Part of our job is to raise awareness about aesthetic medicine and what we can do for patients so that they don't walk around for years or decades suffering from things that they could easily treat. And once we started noticing that they were falling victim to people who were pretending to be doctors or pretending that they were allowed to do these injections when they were not doctors, as well as foreign alleged doctors, there's no way to verify whether they are doctors internationally or not, but they're not registered here with the HPCSA. Once we started getting these complaints, seeing the side effects, seeing the fallout, people suffering from these side effects, we decided that it was time then, and it's all of us doctors who work in this field, or many of us, who decided it was time for us to start making the public aware of what's going on and what they could do in order to address these problems.
Yes. And of course, this is it. It comes down to ignorance again. Let's start with what the law says. In South Africa, who regulates injectables, medical devices, and medical supplies? Who are the regulatory bodies that regulate this?
As far as what we are using to inject into patients, what people are allowed to import, regulating the licenses around importing, selling, distributing, that's SAPRA, so SAHPRA. And any scheduled substance that you sell or that you use in this country needs to be regulated by SAPRA, and it needs to be approved by SAPRA. And it goes for medical devices such as dermal fillers, hyaluronic acid dermal fillers, and it goes for medications such as botulinum toxins or any of the medicines that you would buy from your pharmacy.
Right. So it's correct to say that no medical device or substance can be legally imported, distributed, or sold without SAPRA, which is the South African Health Products Regulatory Authority, right? They cannot do it without a license from them.
Yes, as far as it's concerned, when it comes to the injectable products that we use, that's correct. You are not allowed it. There's no gray area. It's either legal or it's illegal. And so if you are getting injectables from somebody who is not a doctor, you are unlikely to be getting SAPRA approved products because these people can't buy from the regular companies. They can't buy from the distributors of the fillers or the toxins. And so they have to go buying it from boots, as in car boots, and they have to import it without licenses and sneak it in their baggage, which
All right.
is not a temperature controlled environment at all.
Yes, well, we'll get to that. So then who is the Health Professions Council of South Africa, the
So
HPCSA? What do they regulate?
the HPCSA regulates the actual doctors and dentists and nurses and all of the different health professions in the country. And this is where you have to be registered if you want to be legally injecting patients. So doctors and dentists are allowed to inject things like fillers and toxins. Nobody else is actually allowed to inject those products. It doesn't matter how long they've worked in the field. Nurses, for example, can inject simple things, like if you needed to get a painkiller and it was prescribed by a doctor, or you had to have an IV which was prescribed by a doctor who saw you and prescribed it for you individually. then the nurses are allowed to put up that drip, but they're not allowed to do anything that requires specialized skill, such as injecting fillers or toxins.
We also, in sticking to the law, we also have an act that governs licenses, the Medicines and Related Substances Act. Correct?
Yes, correct. So these are not vague at all. These are
No, it's
clearly,
clear.
these are very clear laws that are being broken.
All right. So then who is accountable?
Well, at the end of the day, it's the perpetrators who are the ones who are doing something wrong here. The patients, as we see it, are victims. They've been manipulated, they've been lied to, they've been, coerced or otherwise psychologically manipulated or promised, things that are better than ever. They've been conned. And the people that are doing the conning are well versed at being con men and con women, if that's a word. But it's up to our authorities to take responsibility for putting this to an end. And that would be the SAPS, the HPCSA, and these are the entities that we want the public to report these problems to.
Yes. And then, so at the moment, anybody can buy dermal fillers or injectables. I mean, we've unpacked the law and what the law says. But at the moment, I mean, I can go and find somewhere to buy a dermal filler or an injectable. And is it the ports that are letting these substances in? Is it our ports that are not being regulated? Or is it perhaps that online purchasing has enabled these
Well, customs
dreadful
should be
things?
stopping any importation of any medical substances or medical devices that don't have the proper authorization. I read somewhere, if I remember, if I'm reading correctly, something along the lines of only 2 out of every 100 containers is actually inspected. Now, that might not be true, but somehow these products are getting into the country and people are buying them. Now, it's not a legal thing, but they are buying them and they're using them on themselves or on unwitting public.
Yes. All right, we've clarified the law. How about the doctors now? Do general practitioners need a license or a practice number?
All general practitioners need to have a practice number if they want to be writing scripts, if they want to be claiming from medical aids. And when you are registered with the HPCSA, you'll get something else which is called an MP number, which is your practice
Okay.
number from the HPCSA. And this is the more important one when it comes to buying products, injecting people. If you don't have that number, it's very suspicious. That's why I say to patients, if you want to check out someone that you think is maybe suspicious, ask them.
Dodgy.
Ask them
Yes,
for their HPCSA number. And if they are above board and legitimate, they'll happily give it to you. And you can go and check it out on the
correct.
website.
Yes, yes. All right. So that's it. It's now up to the public to do their homework and to seek out those doctors that are properly registered and have the credentials, have that medical degree, MD, CHB, right? And MD, CHD if you're a dentist. Um, let's really get down to the nitty gritty. Let's look at what the medical risks are. If fake injectables are administered and administered by somebody who is not even properly qualified, and please, doctor, don't hold back. Let's get down to the real stuff.
So there's two important areas here. The one is if you're injecting something that you've bought on the gray market or illegally imported, or who knows where it comes from and what is actually inside there. The gel inside it may be hyaluronic acid filler, it may be ultrasound gel, it may be something far more harmful or far more damaging to your tissue. And in this case, the side effects could vary from anything from nothing happening if you're lucky, as in no effect at all, or very terrible side effects like damage to the tissue, damage, irreparable scarring, and damage to your face. The second side of it is if you actually use hyaluronic acid filler, even if it is legitimate, let's say they somehow manage to convince another doctor to sell it to them, or they've stolen it from another doctor. So if you use hyaluronic acid filler exactly the way it's supposed to be used, into the face, you can cause serious side effects. If you inject it into an artery, you can kill certain areas in the skin. If it backtracks along that artery and ends up feeding into your eye, you can go blind, or it can end up in your brain and you can have a stroke and you can die. So these are actual risks that come with dermal filler injections. And obviously, when you are a medical doctor, you're trained, you understand where those vessels are likely to be, the high risk, medium risk, and lower risk areas. And I published a paper actually a couple years ago, which I'll share with you when we're done here. But it basically talks about the methods to minimize the risks when it comes to injecting patients. You know, you can never remove risk completely. You can't go to zero risk, but you can minimize that risk. And an example or two of this is if you were to inject small amounts of filler in certain areas and you don't do it under high pressure, you use a small needle, for example, these are just ways that you can minimize that risk, then you can make it safer for patients. But if you are somebody who believes that filler is an easy thing to do, that doesn't carry risk, and you shove it in places that it shouldn't go, and you do it under high pressure, high volumes, you can end up blocking vessels and you can end up far more likely to cause these side effects. And that's what we've been seeing. All the doctors have been seeing patients reporting and saying, I was injected by so and so, and this is the side effect I have. I've got a blocked vessel in my lip. Help me. And so, obviously, being a doctor, you need to understand how to treat the side effects. And so, you need to know about hyaluronidase, how to inject it, where to inject it, when to refer to specialized care if we need to see an interventional radiologist. These are the things that doctors know how to do. And when patients go to the illegal injectors, they are literally taking their lives into their own hands.
Doctor, I was just thinking, when one goes to a qualified doctor, a registered practitioner, you usually sign a form before going in to have your treatment or procedure done. Do you think these individuals that are fake doctors, do you think they also get their patients to sign forms? Because what about the Consumer Protection Act? Could that help in some way
You know, they
in
might
terms?
make you sign forms as part of their illusion that they create to make you feel like they are legitimate. But those forms will have no value. If I, for example, was not a doctor and I lied to you, I said I am a doctor, or I am allowed to inject you because I've done some or other course, and you believe me, unfortunately, and you allowed me to inject you, that's basically assault. So, I mean, there may be many different crimes here, but I would imagine impersonating a medical practitioner, fraud,
It's enough.
assault. Anytime someone takes a needle and sticks it into someone else and they're not a doctor or registered to do that, they are committing assault. And so it doesn't matter what the form said. Even if you gave consent to the person to inject you, it's not legal.
So you would have recourse as a victim of
Yes,
something
yes, 100%.
dreadful.
You
Okay.
can report it
But
to the SAPS. You can report it to the HPCSA. And
yes,
the Consumer Protection Act, I don't know if it applies or not. Obviously, you're still a consumer, but there's such a crime involved that they might just refer it to the police.
okay. To your knowledge, has there been any tightening of regulations, more licensing requirements, say, or certification standards, to your knowledge?
No, we haven't seen any increase in the requirements, but the requirements were never the problem. The requirements are there. It is illegal.
Ye-
It's not like the
yes, yes,
UK where nurse injectors can inject or you can do a course
yes,
and inject under a doctor. It's completely clear. Our law says that you cannot inject.
yes. Again, to your knowledge, have there been any disciplinary processes, civil claims, or police investigations of anybody who's reported anybody? And have there been consequences, in other words, to your knowledge?
We know that there has been reports. We know of patients who have taken it further, who have reported it to the HPCSA. According to AMSA, that's the board we're part of as well, there has been some positive action and some positive responses, but we're waiting for some clarity on whether we're allowed to share those details or not.
Mhm. Why do you think? patients trust these people? What do you think is the problem?
Do you know the thing with con men and con women? Let's just call them collectively con men. I mean,
Okay.
everybody. Basically, they're very good at targeting, identifying your weaknesses and your insecurities, playing on them, getting you to understand. They'll judge you based on how you respond, and they'll work you as a regular con man would. Just like you would get people to invest in some fraudulent gold with crazy returns, they do the same thing. They follow the same process and they get people to trust them, and they somehow convince them that, well, I don't have the license because of some small little error in the paperwork, but I am actually a really good doctor. And they'll use obviously AI, they'll use my face app to produce very attractive looking before and after photos, which when we look at them as doctors become suspicious because
You,
we say,
you know,
where are the signs of injections? Where's the needle holes? Where's the swelling? Where's the bruising? And that's what made us start looking at it. But the nice thing is, anybody who is looking at a post on Instagram can say to their Siri, tell me what app was used to modify this picture,
oh,
and it'll
okay.
actually tell you. It'll tell you what
Mm.
settings on the app were used to actually modify those pictures. So there's simple tricks like they'll do a before picture with the patient leaning forward slightly, and then do the after picture with the patient leaning back slightly so that the skin looks like it's tighter, and they mislead people. And so it's really that's how they're getting away with it. They just lie to people. That's
So it
in
is,
a
and
nutshell.
it's a combination of that and social media playing a big role in conning people and getting people to believe it. I think one big red flag for me is the price being advertised in such a big way. You never get a price from a doctor. Everybody's unique and everybody will require different dosage or units to each area. So you would never advertise a price. That'd
There's
be a
two
red
things, important things about price. Doctors are not allowed to advertise their prices of their registered
flag.
medications and substances. And so if you see anyone posting a price or using the brand names of botulinum toxins or fillers, that's a major red flag. That'll tell you already that either it's an unethical doctor or it's an illegal practice. It may be illegally owned, as in not owned by a doctor, or it may be somebody who's not a doctor at all. And so that's a big major red flag. The other thing is, because we're not allowed to advertise prices, it creates this expectation or this misunderstanding with the public that doctors are too expensive, or it'll end up being a lot more expensive than the illegal injectors. And the funny thing is,
Mm.
it's because when you were a teenager and you were looking at the cars in the auto trader, the best cars always had POA. They never showed you the price. And so people associate that and they think, oh, there's no price, it must be expensive. But what
Mm.
we've seen is some of these illegal injectors are charging up to 6 times as much as legitimate legal doctors for the same service. And so that's the thing, it's not much cheaper. Sometimes when you see that they are charging things for a full milliliter of filler, they charge 1,000 rand. That's below the cost price of a milliliter of filler. So you then have to wonder again, what are they injecting into the patients and still walking away with a profit? And so those are the two extremes of it. Sometimes they manage to convince people to do large down payments, which is also illegal. Doctors are not allowed to take money for anything that they haven't performed or won't
Oh,
perform.
yes.
And so it's another red flag again. If someone says you must pay me for the next 6 sessions of filler, which I'll do for you, and it's non-refundable, then that becomes a problem. That's not allowed. We're not allowed to do specials where we combine fillers and toxins and say, well, we'll give it to you at a better price. That's not
It's
ethical.
yes. And also it could be very unscrupulous people as well, because if it's not the genuine filler, if somebody wants to reverse something, then if it's diluted or if it contains other substances or whatever, it won't work.
We use something called hyaluronidase. It's an enzyme that breaks down hyaluronic acid. And
Yes.
when we use fillers such as platelet derived, platelet rich fibrin fillers, we use heparin. And these are two substances that we know will break down these products. The problem is if you use something else, it could be gel, who knows what it is, hyaluronidase will not work. It won't break it down. You won't be able to reverse the procedure.
Yeah.
If it's something like silicone, that's a permanent implant that needs to be surgically removed. So you could cause yourself major problems.
Mm. I wonder if injectables could be made prescription only. Do you think that would work?
Well, it already is prescription only. You cannot go into a pharmacy and
True.
buy off the shelf fillers or botulinum toxin. You have to get it from a doctor who's injecting it into you. The public can't just go into a pharmacy and collect these products that need to be injected.
Mm. So we've gone through the red flags, the terminology as well, which would be used online is not clinical. They overpromise, as you say, they overpromise results. There are before and after photos that are just not credible. But we also have to remember that there's no medical oversight on these procedures. If they are fake doctors, there's no medical oversight, there's no sterile environment, there's no emergency management capability wherever they're doing these procedures. And I think that's what the public needs to keep in mind when all of a sudden they see something online and they think, oh, this is for me. There is a national register for qualified practitioners, and we need to do the homework. So, what, in your view, could change? Would there be a regulatory change that would improve public safety?
I think what's happening right now with media helping to create awareness and attention around the problem is a big step. It will get people to understand the risks, get people to understand that there are alternatives that are safer, cheaper, better. And I've seen some very scary things. I've seen videos with non-medical injectors blowing their nose, touching their phone, continuing injecting, not understanding that you can create severe infections by injecting under those conditions. And so people do need to be more scared. They need to be more afraid of these treatments. And I think what we're trying to do and what I'm trying to do, especially with AMSA, is to get our members to allow us to file criminal charges on behalf of the society. And if not, I'll probably do it as a doctor, as a concerned doctor, because sometimes people will say, well, if there isn't a willing victim, but there possibly are witnesses, there's evidence, it's almost like a drug dealer. If the
Yes,
police catch a drug dealer with a kilogram of cocaine, nobody says, oh, well, where's the victim? They know, well, you've got this kilogram of cocaine because you were going to sell it. You weren't going to take it for yourself. And so we want there to be more criminal proceedings. Once more of these illegal injectors are jailed and the press starts carrying that story, it becomes scary. So when somebody is in Turkey or whatever country they're in and they're looking for a breeding or a hunting ground where they can go and find some innocent victims, they don't look at South Africa as an easy target. They think of it as a scary place where if you go there and you break the laws and you hurt the public, the doctors there are going to help the police to find you and catch you and put you in jail. And that's what we really want to see happening.
consequences.
Exactly.
And for somebody who is thinking of having an aesthetic procedure or a treatment done, I would say that most of the doctors that I know make a plan for that patient. If they're on a budget, they sit down at the consultation and say, right, this is what we would like to do. This is our aim. Let's break it down on a yearly kind of a basis where you can have, say, 2 or 3 procedures in that year to fit your budget. As far as I know, that does happen.
100%. You know, we're always saying to patients not to be shy, to tell us what your budget is, tell us where you want to focus your attention. If you show us exactly what it is you're worried about, we can offer alternatives, options. We can stretch out treatments, separate it over different months. There's many ways that we can make the costs of the treatment match exactly what the patients want to spend. Obviously, we can't do anything for free, but we can make it so affordable and easy that
Oh,
patients don't feel like they're being hauled over the coals.
yes, and it's not such an overwhelming expense. You can actually budget to have good, healthy, functional skin.
No, for
Um,
sure. I mean, I would
but
say to patients, it's a lot cheaper than buying a big fancy handbag. It's cheaper than, I can tell you average prices. I don't have to tell you exactly what each individual doctor charges, but fillers can vary between 4 and 8,000, and botulinum toxins can vary between 80 and 100 rand a unit. That's kind of what people are charging out there. But it doesn't break the bank, and it doesn't have to break the bank.
all right. And your personal message, Doctor, to the public today as we close off this conversation, what would you say is good advice?
Respect yourself enough not to fall victim to these con men. The most important thing is you only have one face, you only have one body. You can save money rather on an outfit or on a handbag. If you have a face and body that's really attractive, you can almost wear anything and it will look good. The opposite is not true. If you spend all your money on an outfit and you neglect your face, or you have major side effects and you look like you've been worked on and you don't have the right result. We have two mottos. One is art meets science, the other one is timeless elegance. And that's the things that we have to apply to every single patient. And if you're not getting that kind of treatment from the person that's injecting you, then you're shortchanging yourself. So don't take chances just because, again, you think you're saving money. Because doctors are very easy to talk to. Nobody's going to judge you and say, oh, well, why did you come here if you don't have enough money? We've never said that to anybody in the history of our practice, and no doctors will tell you that. They'll work with what you can afford to do.
I mean, as the aesthetic industry continues to expand, this conversation around safety, regulation, and accountability becomes more important than ever. And ultimately, I think informed patients, as you so rightly said, just inform yourself. Informed patients and responsible practitioners may be the strongest defense against unsafe practice.
Last thing is to use the tools available. Go to the HPCSA website, type in the
Yes.
doctor's name and surname if you don't have the MP number, and they should pop up. If they don't pop up, ask them. Say, I noticed that I couldn't find you on the HPCSA website, and maybe they've changed their surname or something like that. But if there's no reasonable explanation, or they get angry with you, or they cut you off, or they change their story or block you, then that's enough of an answer.
Yes. So it's really up to you, the public, to do your homework. And it's not very difficult to go online and see if the doctor recommended to you or that you've seen is registered. And you'll be safe in a sterile clinic with the right safe practice. Thank you so much, Dr. Reza, for joining me today on Aesthetically Speaking, and as well for creating so much awareness around the subject.
Only a pleasure. We'll always do our best.